patient. So you take the blood pressure and the O2 saturation, and you'd also need a stethoscope to listen to the lung sounds. You'll also need protective equipment for yourself, such as a mask with a face shield, a gown, and clean gloves. This is to protect yourself from any secretions the patient can cough up. You'll also need a bottle of normal saline and hydrogen peroxide. These will be your cleaning solutions. You'll need a tracheostomy clean and care tray, which will contain sterile gloves, a sterile field, a brush, and pipe cleaners to clean your cannula, and Q-tips to clean your faceplate, gauze to also clean and dry your patient's skin, a dressing which will go underneath the faceplate and will absorb any secretions, and tracheostomy ties. You'll also need a suction catheter kit. This is sterile, and it will contain a sterile field, a container to put your normal saline into, sterile gloves, and the actual suction that will go into your cannula. You will also need an ambu bag to provide oxygenation to your patient.
To begin suction, the nurse will wash her hands and make sure she is wearing a gown, a mask with a shield, and clean gloves. She will then check the patient's ID bracelet for the patient's name, medical record number, and date of birth. The nurse will then check to see that she has all of her supplies. She will need the suction catheter kit, normal saline, and sterile and non-sterile gloves. The nurse will then check for her ampu bag. This will be used for hyperoxygenation of the patient and will be connected to 100% oxygen. The nurse will then check suction. Suction should be at medium level between 120 and 150 millimeters of mercury pressure. The procedure should be explained to the patient. The nurse will then do a respiratory assessment. She will check respiratory rate, lung sounds, as well as heart rate and rhythm. And O2 sat. The nurse will explain to the patient that she will be suctioning. Suctioning is indicated because our trach patient has rhonchi and ineffective coughing. The nurse will then check the expiration date of the normal saline. She will date, time, and initial the bottle. It will be good for 24 hours. The nurse should then open up her kit, place the drape over the patient's chest. She will note the catheter size, which should fit the trach size. The nurse should then set up her cup for normal saline and pour her normal saline. The nurse should then hyperoxygenate the patient. The nurse should then put on her sterile gloves. The nurse's dominant hand, her right hand, will be the sterile hand. The nurse will then attach the catheter to suction. The nurse will then clear the line She will then insert the catheter until the nurse hits resistance or the patient starts to gag. She will withdraw the catheter 1/2 inch to 1 inch, then apply suction for no more than 10 seconds. She could repeat the procedure until the airway is clear. Suctioning should be discontinued if the heart rate decreases from baseline by 20 beats per minute, increases by 40 beats per minute, a dysrhythmia occurs, or O2 sat decreases to less than 90%. The nurse should then clear the line. And note the patient's respiratory rate, lung sounds, and O2 sat. The nurse will note the patient's response to suctioning and the type and amount of secretions and chart her findings. She will then dispose of the catheter, gloves, remove her gown, and wash her hands.